Question 1. Regulatory review indicates that certified diabetes technology clinicians, CDTC, are expected to educate patients on the fundamental principles of various diabetes management technologies. When comparing a continuous glucose monitor, CGM, with an insulin pump, which of the following best describes the distinct mechanisms of action that a CDTC should articulate to a patient? Option A. A CGM provides data for insulin dosing decisions, and an insulin pump automates insulin delivery based on that data. Option B. Both devices primarily function to lower blood glucose levels through direct intervention. Option C. A CGM displays real-time glucose values, and an insulin pump administers insulin to correct high glucose readings. Option D. A CGM measures glucose in interstitial fluid via a sensor to provide readings and trends, while an insulin pump delivers insulin subcutaneously based on programmed settings and user input. The correct answer is D. A CGM measures glucose in interstitial fluid via a sensor to provide readings and trends, while an insulin pump delivers insulin subcutaneously based on programmed settings and user input. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a clinician to differentiate between the mechanisms of action of two distinct classes of diabetes technology, specifically continuous glucose monitors, CGM, and insulin pumps, in the context of patient education and device selection. Misunderstanding these fundamental differences can lead to inappropriate device recommendations, suboptimal patient outcomes, and potential noncompliance with regulatory guidelines regarding device functionality and patient understanding. The challenge lies in translating complex technological principles into clear, actionable information for patients, while adhering to the specific regulatory framework governing diabetes technology. Correct approach analysis. The correct approach emphasizes understanding and explaining the distinct mechanisms of action for CGMs and insulin pumps. CGMs primarily function by measuring interstitial glucose levels through a sensor, translating these readings into data displayed on a receiver or smartphone, and providing trend information. Their mechanism of action is focused on glucose sensing and data interpretation. Insulin pumps, conversely, deliver insulin subcutaneously based on programmed basal rates and bolus calculations, often in conjunction with CGM data. Their mechanism of action is centered on insulin delivery and dose management. A clinician demonstrating this understanding can accurately educate patients on how each device functions independently and, if applicable, how they integrate. This aligns with regulatory expectations for providing comprehensive and accurate information to patients regarding medical devices, ensuring informed consent and appropriate use. This approach upholds the principle of patient autonomy and promotes effective self-management of diabetes, which are core tenets of diabetes care and regulatory oversight. Incorrect approaches analysis. One incorrect approach would be to conflate the functions of CGMs and insulin pumps, describing both as solely glucose-lowering devices. This fails to acknowledge the fundamental difference in their primary mechanisms of action, sensing versus delivery. Such a generalized description would be a regulatory failure, as it misrepresents the core functionality of each device, potentially leading to patient confusion about what each device actually does and how it contributes to their diabetes management. Another incorrect approach would be to focus solely on the output of the devices, e.g., glucose readings or insulin doses, without explaining the underlying mechanism that generates that output. For instance, describing a CGM as showing you your sugar without explaining the sensor technology and interstitial fluid measurement is incomplete. Similarly, describing an insulin pump as giving you insulin without mentioning basal rates, boluses, and the delivery mechanism is insufficient. This lack of detail constitutes a failure to provide adequate patient education as mandated by regulatory bodies, which expect clinicians to explain how devices work to enable informed decision-making and proper utilization. A third incorrect approach would be to prioritize the integration of CGMs and insulin pumps, e.g., automated insulin delivery systems, over explaining their individual mechanisms of action. While integration is a crucial aspect of modern diabetes technology, it builds upon the foundational understanding of each component. Presenting integration as the primary mechanism, without first clarifying the individual roles of sensing and delivery, would be a pedagogical and regulatory misstep. Patients need to grasp the independent functions before understanding how they work together, ensuring they can troubleshoot or manage devices even when integration is not fully functional. Professional reasoning. Professionals should approach this by first identifying the core function of each device, sensing for CGMs and delivery for insulin pumps. They should then articulate these functions using clear, patient-friendly language, avoiding overly technical jargon. The next step involves explaining how these functions contribute to diabetes management, highlighting the unique benefits and limitations of each. When discussing integrated system, the explanation should build upon the previously established individual mechanisms, clarifying how the sensing data informs the delivery decisions. This systematic approach ensures comprehensive patient education, fosters informed consent, and aligns with regulatory requirements for device understanding and safe use. Question 2. Process analysis reveals that a patient with type 1 diabetes, currently managed with multiple daily injections, MDI, has experienced a notable increase in their basal and bolus insulin requirements over the past 6 months, coinciding with a rise in the frequency and severity of hypoglycemic episodes. The patient expresses frustration with the current regimen's inflexibility and the constant burden of glucose monitoring and insulin adjustments. Considering these factors, which of the following represents the most appropriate next step in managing this patient's diabetes technology needs? Option A. Initiate a trial of an advanced hybrid closed-loop aid, insulin pump system integrated with continuous glucose monitoring, CGM, providing comprehensive training on its features and algorithms, and scheduling regular follow-ups to optimize settings and address any challenges. Option B. Suggest the patient consider a basic insulin pump without CGM integration, emphasizing manual adjustments of basal rates and bolus calculations based on their current understanding of their insulin needs. Option C. Recommend switching to a different brand of insulin pens and exploring different insulin formulations, without considering alternative delivery systems, to see if this improves glycemic control and reduces hypoglycemia. Option D. Advise the patient to continue with their current MDI regimen, focusing on stricter carbohydrate counting and more frequent self-monitoring of blood glucose, SMBG, to better manage their insulin doses and avoid hypoglycemia. The correct answer is A. Initiate a trial of an advanced hybrid closed-loop aid, insulin pump system integrated with continuous glucose monitoring, CGM, providing comprehensive training on its features and algorithms, and scheduling regular follow-ups to optimize settings and address any challenges. Explanation. This scenario presents a common challenge in diabetes technology. Selecting the most appropriate insulin delivery system for a patient with type 1 diabetes who has recently experienced a significant increase in their daily insulin needs and frequent hypoglycemic events, despite using a traditional multiple daily injection, MDI regimen. The challenge lies in balancing the patient's evolving clinical needs with the available technological options, ensuring safety, efficacy, and adherence, all within the regulatory framework governing diabetes technology. The correct approach involves a comprehensive assessment of the patient's current regimen, lifestyle, and preferences, followed by a discussion of advanced insulin delivery systems that can offer improved glycemic control and safety. This includes considering insulin pump therapy with advanced features like continuous glucose monitoring, CGM, integration and automated insulin delivery, AID, algorithms. This approach aligns with best professional practice by prioritizing patient-centered care, evidence-based decision-making, and adherence to guidelines that promote optimal diabetes management. Specifically, it reflects the CDTC role in educating patients about and facilitating access to appropriate technologies that can mitigate risks like hypoglycemia and improve quality of life, as supported by professional standards of care and potentially by payer guidelines for medical necessity. An incorrect approach would be to recommend a system without a thorough patient assessment, such as immediately suggesting a specific pump, without understanding the patient's dexterity or willingness to manage a device, or conversely, to dismiss advanced technologies due to a perceived complexity that could be overcome with proper training. Another incorrect approach would be to continue with the current MDI regimen without exploring alternatives, given the documented increase in insulin needs and hypoglycemic events, which could be interpreted as a failure to provide adequate care and explore potentially safer and more effective treatment options. Ethically, failing to explore all appropriate therapeutic avenues when a patient is experiencing significant glycemic challenges and safety concerns hypoglycemia, could be considered a breach of the duty of care. Regulatory frameworks often emphasize the use of evidence-based practices and patient-centered decision-making, which would be violated by a superficial or dismissive approach to advanced diabetes technologies. The professional decision-making process for similar situations should involve a systematic evaluation. First, thoroughly understanding the patient's current diabetes management, including their challenges, successes, and daily routines. Second, educating the patient about the spectrum of available insulin delivery systems, from basic MDI to sophisticated AID systems, highlighting the pros and cons of each in relation to their specific situation. Third, collaboratively deciding on the most suitable option, considering factors like glycemic targets, hypoglycemia risk, patient lifestyle, technological literacy, and financial/insurance coverage. Finally, ensuring comprehensive training and ongoing support for the chosen system to maximize its benefits and minimize potential risks. Question 3. The assessment process reveals a patient using a continuous glucose monitoring (CGM) system is experiencing a rapid downward trend in glucose readings, indicated by multiple downward arrows on the device display, and a current reading of 75 mg/dl. The patient, however, reports feeling no symptoms of hypoglycemia and states they have recently consumed a balanced meal. What is the most appropriate clinical decision-making approach in this situation? Option A. Increase the basal insulin dose to counteract the perceived impending hypoglycemia. Option B. Immediately administer glucagon based on the rapid downward trend, despite the absence of hypoglycemic symptoms. Option C. Advise the patient to ignore the CGM readings for the next hour and reassess, as they are not experiencing any symptoms. Option D. Initiate immediate carbohydrate intake and closely monitor glucose levels, while also discussing the discrepancy between the CGM data and the patient's subjective experience to understand potential contributing factors. The correct answer is D. Initiate immediate carbohydrate intake and closely monitor glucose levels, while also discussing the discrepancy between the CGM data and the patient's subjective experience to understand potential contributing factors. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinician to integrate real-time data from a diabetes technology device with a patient's subjective experience and established clinical guidelines to make an immediate, potentially life-altering treatment adjustment. The clinician must navigate the nuances of data interpretation, recognizing that technology provides valuable insights but does not replace clinical judgment or the patient's individual response to therapy. The pressure to act decisively while ensuring patient safety and adherence to best practices, as outlined by relevant professional bodies and regulatory frameworks governing diabetes care, adds to the complexity. Correct approach analysis. The correct approach involves a comprehensive review of the continuous glucose monitoring (CGM) data, considering the trend arrows, current glucose level, and the rate of change, alongside the patient's reported symptoms and recent lifestyle factors, e.g., diet, exercise, stress. This holistic assessment allows for an informed decision that balances the technological data with the patient's lived experience. This aligns with the principles of patient-centered care and evidence-based practice, which are foundational to the Certified Diabetes Technology Clinician (CDTC) certification. The clinician's responsibility is to interpret the data within the context of the individual patient, ensuring that any therapeutic adjustment is safe, effective, and tailored to their unique needs, as supported by guidelines from organizations like the American Diabetes Association (ADA) and the Food and Drug Administration (FDA). Regarding the use of diabetes technology, correct approach is analysis. One incorrect approach would be to solely rely on the CGM's automated alerts or a single data point without considering the broader clinical picture. This fails to acknowledge the potential for device inaccuracies, the influence of external factors on glucose readings, and the importance of the patient's subjective experience. Ethically, this could lead to inappropriate treatment decisions, potentially causing hypoglycemia or hyperglycemia, and violates the principle of beneficence by not acting in the patient's best interest. Regulatory frameworks emphasize the clinician's role in interpreting data and making informed decisions, not blindly following automated prompts. Another incorrect approach would be to dismiss the CGM data entirely because the patient reports feeling fine, without a thorough investigation of the data and the patient's perception. While patient feedback is crucial, ignoring significant deviations indicated by the technology without understanding the discrepancy could lead to missed opportunities for intervention or the exacerbation of an underlying issue. This approach risks violating the duty of care and could be seen as a failure to utilize available diagnostic tools effectively, which is implicitly expected when a patient is using diabetes technology under clinical guidance. A third incorrect approach would be to make a drastic treatment change based solely on a single, isolated high or low glucose reading, without observing a sustained trend or considering the patient's recent activities. This could lead to overtreatment or undertreatment, causing significant glycemic excursions. This demonstrates a lack of nuanced data interpretation and a failure to apply sound clinical reasoning, which are core competencies for a CDTC. It also overlooks the dynamic nature of glucose management and the need for a comprehensive understanding of the factors influencing glycemic control. Professional reasoning. Professionals should adopt a systematic approach. First, acknowledge and validate the patient's reported symptoms and concerns. Second, meticulously review the available CGM data, paying attention to trends, patterns, and the context of the readings, e.g., time of day, meal times, exercise. Third, correlate the technological data with the patient's subjective experience and recent lifestyle factors. Fourth, consider the patient's individual glycemic targets and treatment goals. Fifth, formulate a treatment plan that is safe, effective, and patient-centered, clearly communicating the rationale to the patient and establishing a plan for follow-up and monitoring. This process ensures that decisions are evidence-based, ethically sound, and aligned with regulatory expectations for the safe and effective use of diabetes technology. Question 4. Implementation of a new continuous glucose monitoring (CGM) system for a patient with type 1 diabetes presents an ethical dilemma for the certified diabetes technology clinician. The patient, a busy professional, expresses a desire for a device that offers real-time data, trend arrows, and seamless integration with their insulin pump, but also mentions concerns about the cost and the learning curve associated with complex interfaces. The clinician is aware of several CGM devices on the market, each with varying features, accuracy levels, data sharing capabilities, and price points. Which of the following approaches best navigates this ethical and clinical challenge? Option A. Prioritize a CGM system that is known for its user-friendliness and lower cost, even if it offers fewer real-time data insights or integration options, to ensure immediate patient comfort and adherence. Option B. Recommend the most advanced CGM system with the latest features and highest accuracy, assuming the patient will adapt and that the benefits outweigh the initial cost and learning curve. Option C. Engage in a detailed discussion with the patient about their specific needs, lifestyle, financial constraints, and technological comfort level, presenting a balanced overview of available CGM devices, and collaboratively selecting the system that best meets their individual requirements and goals. Option D. Suggest a CGM system that the clinician has personally found easiest to manage and interpret data from, as this familiarity will likely lead to more efficient patient support and better overall outcomes. The correct answer is B. Recommend the most advanced CGM system with the latest features and highest accuracy, assuming the patient will adapt and that the benefits outweigh the initial cost and learning curve. Explanation. This scenario presents a professional challenge due to the ethical imperative to provide patient-centered care while navigating the diverse landscape of continuous glucose monitoring, CGM devices, and their associated data. Clinician must balance the patient's immediate needs and preferences with the long-term implications of device selection, ensuring informed consent and adherence to best practices in diabetes management technology. Careful judgment is required to avoid bias and to ensure the chosen device aligns with the patient's clinical profile, lifestyle, and technological literacy. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the patient's needs and capabilities. This involves a thorough discussion of various CGM device types, including their functionalities, data presentation, accuracy profiles, and integration capabilities with other diabetes technologies. By empowering the patient with this knowledge and collaboratively selecting a device that best suits their specific circumstances, the clinician upholds the ethical principles of autonomy and beneficence. This aligns with the regulatory framework's emphasis on patient education and shared decision-making, in the selection of medical devices, ensuring that the chosen technology will be effectively utilized to improve glycemic control and quality of life. An incorrect approach that solely focuses on the newest or most technologically advanced CGM device, without considering the patient's ability to utilize its features or their financial situation, would be professionally unacceptable. This fails to meet the ethical obligation of beneficence, potentially leading to device abandonment, frustration, and suboptimal glycemic management. It also risks violating regulatory guidelines that mandate the selection of appropriate medical devices based on individual patient needs, not just technological novelty. Another incorrect approach would be to recommend a device based on personal familiarity or a perceived ease of use for the clinician, rather than a thorough assessment of the patient's unique requirements. This demonstrates a failure of objectivity and could lead to a suboptimal choice for the patient, potentially impacting their adherence and the effectiveness of the therapy. Ethically, this prioritizes clinician convenience over patient well-being and may contravene regulatory expectations for unbiased device recommendation. Finally, an approach that neglects to discuss the data interpretation and actionable insights provided by different CGM devices, focusing only on the sensor insertion, would be incomplete. This overlooks a critical aspect of CGM technology, its ability to inform treatment decisions. Failing to educate the patient on how to leverage this data for self-management and to discuss how it integrates with their overall diabetes care plan is a disservice and could lead to underutilization of the technology's benefits, potentially impacting adherence and outcomes. This oversight could be seen as a failure to provide adequate patient education, a cornerstone of effective diabetes technology implementation. The professional decision-making process for similar situations should involve a structured approach. First, conduct a thorough patient assessment encompassing clinical status, lifestyle, technological proficiency, and financial considerations. Second, educate the patient comprehensively on the available CGM device options, highlighting their respective strengths, limitations, and data outputs. Third, engage in shared decision-making, collaboratively selecting the device that best aligns with the patient's individual needs and goals. Fourth, ensure adequate training and ongoing support for device use and data interpretation. Question 5. Operational review demonstrates a patient using an insulin pump is experiencing persistent hyperglycemia, with blood glucose readings consistently above their target range, despite reporting strict adherence to their prescribed insulin regimen and diet. The patient denies any recent illness or changes in activity levels. As a certified diabetes technology clinician, what is the most appropriate initial step to address this persistent issue? Option A. Advise the patient to increase their physical activity to help lower blood glucose levels, as this is a common factor in unexplained hyperglycemia. Option B. Recommend the patient temporarily discontinue the insulin pump and switch to multiple daily injections of long-acting insulin until the issue is resolved. Option C. Conduct a thorough inspection of the insulin pump's infusion set, cannula site, and tubing for any signs of kinking, blockage, dislodgement, or leakage, and review the patient's technique for insertion and site management. Option D. Immediately adjust the patient's basal insulin rates and bolus factors, assuming a physiological change has occurred that is impacting insulin absorption. The correct answer is C. Conduct a thorough inspection of the insulin pump's infusion set, cannula site, and tubing for any signs of kinking, blockage, dislodgement, or leakage, and review the patient's technique for insertion and site management. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in diabetes technology management. A patient experiencing recurrent unexplained hyperglycemia despite consistent insulin regimen adherence. The professional challenge lies in accurately diagnosing the root cause of the delivery failure, which could stem from device malfunction, user error, or physiological factors, all of which directly impact glycemic control and patient safety. The clinician must navigate this without causing undue patient distress or compromising the therapeutic alliance. Correct approach analysis. The correct approach involves a systematic, patient-centered investigation that prioritizes device integrity and proper technique. This aligns with the ethical obligation to provide competent care and the regulatory expectation to ensure the safe and effective use of medical devices. By meticulously examining the insulin pump's infusion set, cannula site, and the patient's technique, The clinician is directly addressing potential mechanical failures or user-related issues that could impede insulin delivery. This methodical approach ensures that the most probable causes of delivery failure are ruled out first, leading to a more efficient and accurate resolution. This is best professional practice as it directly addresses the technological aspect of diabetes management, a core competency for a certified diabetes technology clinician, and adheres to guidelines emphasizing patient education and device troubleshooting. Incorrect approaches analysis. One incorrect approach involves immediately assuming a physiological issue without thoroughly investigating the insulin delivery system. This bypasses the fundamental responsibility of a CDTC to troubleshoot the technology itself. Ethically, this could be seen as a failure to provide due diligence in assessing the device, potentially leading to delayed or incorrect treatment adjustments. From a regulatory standpoint, it might violate guidelines that mandate thorough device assessment before altering therapy. Another incorrect approach is to solely rely on the patient's self-reported adherence without objective verification of the insulin delivery system's function. While patient reporting is important, it is not a substitute for objective assessment of the technology. This approach risks overlooking device malfunctions or subtle errors in technique that the patient may not be aware of or able to articulate. This could be considered a failure to meet the standard of care expected of a technology specialist, potentially leading to suboptimal patient outcomes and contravening regulatory requirements for device efficacy monitoring. A third incorrect approach is to dismiss the issue as minor or transient without a thorough investigation. Unexplained hyperglycemia can have serious short-term and long-term consequences for individuals with diabetes. Failing to investigate thoroughly could be viewed as a breach of the duty of care, potentially violating ethical principles of beneficence and non-maleficence, and could also fall short of regulatory expectations for proactive management of diabetes technology. Professional reasoning. When faced with unexplained hyperglycemia in a patient using insulin delivery technology, a CDTC should employ a structured problem-solving framework. This begins with a comprehensive review of the patient's reported symptoms and adherence, followed by a detailed, hands-on assessment of the insulin delivery device and its components. This includes inspecting the infusion set for kinks or blockages, checking the cannula site for signs of dislodgement or inflammation, and verifying proper device settings and reservoir levels. Concurrently, a review of the patient's technique for insertion, site rotation, and device operation is crucial. If device-related issues are ruled out, then consideration of physiological factors or external influences can be more confidently addressed. This systematic approach ensures that the most probable causes related to the technology are investigated first, aligning with the CDTC specialized expertise and the ethical and regulatory imperative to ensure safe and effective diabetes technology use. Question 6. Market research demonstrates a growing interest among patients with diabetes in utilizing advanced features of blood glucose monitoring, BGM, devices, such as trend analysis and predictive alerts, beyond basic glucose readings. A certified diabetes technology clinician, CDTC, is advising a patient on selecting a new BGM system. Which of the following approaches best aligns with regulatory compliance and professional best practices for patient education regarding BGM devices in the United States? Option A. Relying on general knowledge of BGM technology and assuming all devices provide similar accuracy and data interpretation capabilities. Option B. Reviewing the FDA's cleared indications for use for each BGM device to ensure the patient is informed about its approved functionalities and limitations. Option C. Suggesting a BGM device that offers the most advanced technological features, assuming they will benefit the patient regardless of specific FDA clearance for those features. Option D. Recommending a BGM device based on its latest marketing materials and positive testimonials from online patient forums. The correct answer is B. Reviewing the FDA's cleared indications for use for each BGM device to ensure the patient is informed about its approved functionalities and limitations. Explanation. Scenario analysis. This scenario presents a professional challenge due to the rapid evolution of diabetes technology and the need for clinicians to stay abreast of regulatory requirements for patient education and device selection. Ensuring patients receive accurate, Up-to-date information about blood glucose monitoring, BGM devices, particularly regarding their approved indications for use and data interpretation, is paramount for patient safety and effective diabetes management. The clinician must navigate the complexities of device capabilities, manufacturer claims, and regulatory oversight to provide evidence-based guidance. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient safety and adherence to regulatory guidelines. By consulting the FDA's cleared indications for use for each BGM device, the clinician ensures that the information provided to the patient aligns with the manufacturer's approved claims and intended purpose. This regulatory compliance prevents the misrepresentation of device capabilities, which could lead to inappropriate treatment decisions or a false sense of security for the patient. Ethical practice dictates that clinicians provide accurate and unbiased information, grounded in regulatory approval, to empower patients in their self-management. Incorrect approaches analysis. One incorrect approach involves relying solely on marketing materials or anecdotal evidence from other patients. This fails to meet regulatory requirements because marketing materials may not always reflect the cleared indications for use and can sometimes overstate a device's capabilities. Anecdotal evidence, while potentially informative, is not a substitute for regulatory approval and can be misleading or inaccurate. This approach risks providing patients with information that is not supported by evidence or regulatory oversight, potentially leading to incorrect interpretations of glucose readings and suboptimal care. Another incorrect approach is to recommend a BGM device based on its perceived technological advancement or features not explicitly cleared by the FDA for the patient's specific needs. This violates regulatory compliance by promoting or suggesting off-label use or capabilities not validated by the regulatory body. Such recommendations can lead to patient confusion, misinterpretation of data, and potentially unsafe treatment adjustments. Ethical considerations are also compromised, as the clinician is not acting in the patient's best interest by recommending a device based on unproven or uncleared functionalities. A third incorrect approach is to assume that all BGM devices provide equivalent accuracy and data interpretation capabilities, without verifying their specific regulatory clearances. This overlooks the critical role of regulatory bodies like the FDA in ensuring device safety and efficacy. Different devices may have varying levels of accuracy, specific algorithms for data analysis, or limitations that are detailed in their cleared indications. Failing to verify these specifics can lead to the patient receiving inaccurate information about their glucose trends or making treatment decisions based on flawed data, thereby compromising patient safety and the clinician's professional responsibility. Professional reasoning. Professionals should adopt a systematic approach that begins with understanding the patient's individual needs and then rigorously verifying the regulatory status and cleared indications for any recommended BGM technology. This involves actively consulting official regulatory databases, e.g., FDA 510(k) database for cleared devices, and manufacturer documentation that aligns with these clearances. When presented with new technologies or features, the professional must exercise due diligence to confirm their regulatory approval and understand their validated applications before incorporating them into patient education or recommendations. This process ensures that patient care is evidence-based, ethically sound, and compliant with all applicable regulations. Question 7. The risk matrix shows a patient with a history of frequent hypoglycemia, currently experiencing an upward trend in fasting blood glucose readings and a significant increase in postprandial glucose excursions, despite consistent insulin dosing. Which of the following interpretations of this data best guides the next clinical decision? Option A. Upward trend in fasting glucose readings indicates a need to significantly increase the basal insulin dose to address the persistent hyperglycemia, and the postprandial excursions can be managed with increased physical activity. Option B. The increased postprandial glucose excursions are the primary concern and require an immediate increase in bolus insulin at meal times to bring these readings down, as fasting glucose is only slightly elevated. Option C. The upward trend in fasting glucose and increased postprandial excursions, in conjunction with the patient's history of hypoglycemia, necessitates a careful review of the current insulin regimen, considering potential adjustments to basal insulin, bolus insulin ratios, or the introduction of a correction factor, while closely monitoring for any signs of hypoglycemia. Option D. The patient's history of hypoglycemia is the most critical factor, and the current glucose readings, despite the upward trend, should be managed with minimal intervention to avoid any risk of further hypoglycemic events. The correct answer is C. The upward trend in fasting glucose and increased postprandial excursions, in conjunction with the patient's history of hypoglycemia, necessitates a careful review of the current insulin regimen, considering potential adjustments to basal insulin, bolus insulin ratios, or the introduction of a correction factor, while closely monitoring for any signs of hypoglycemia. Explanation: the risk matrix shows a patient with a history of frequent hypoglycemia, currently experiencing an upward trend in fasting blood glucose readings and a significant increase in postprandial glucose excursions, despite consistent insulin dosing. This scenario is professionally challenging because it requires the clinician to interpret complex, multifaceted glucose data in the context of a patient's individual risk factors and treatment regimen, balancing the immediate need to address hyperglycemia with the long-standing risk of hypoglycemia. Careful judgment is required to avoid overcorrection or undercorrection, which could lead to adverse health outcomes. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered interpretation of the blood glucose data. This involves considering the entire glucose profile, not just isolated readings, and correlating it with the patient's reported symptoms, lifestyle, and medication adherence. This approach aligns with the ethical obligation to provide individualized care and the regulatory expectation to base clinical decisions on a thorough assessment of patient data. It also reflects the CDTC role in leveraging technology to optimize diabetes management, which necessitates understanding the nuances of continuous glucose monitoring, CGM, and blood glucose meter, BGM data. An incorrect approach that focuses solely on the current high fasting glucose readings and immediately increases basal insulin without considering the patient's history of hypoglycemia or the postprandial spikes would be a regulatory and ethical failure. This could lead to severe hypoglycemia, violating the duty of care and potentially contravening guidelines on safe medication management. Another incorrect approach that dismisses the upward trend in fasting glucose because the postprandial excursions are still within a tolerable range, without investigating the underlying causes or potential for future complications, would also be professionally unacceptable. This demonstrates a failure to proactively manage diabetes and address emerging trends, potentially leading to long-term complications, and failing to meet the standard of care expected of a CDTC. A third incorrect approach that relies solely on patient self-reporting of symptoms without validating with the glucose data would be a failure to utilize the technological tools available and could lead to misdiagnosis or inappropriate treatment adjustments. The professional reasoning process for similar situations should involve a systematic review of all available data, including CGM trends, BGM readings, patient-reported symptoms, and lifestyle factors. The clinician should then assess the overall glycemic control, identify specific patterns of hyperglycemia or hypoglycemia, and evaluate the potential contributing factors. Based on this comprehensive assessment, a personalized treatment plan should be developed, with clear goals and strategies for monitoring and adjustment, always prioritizing patient safety and well-being. Question 8. Investigation of the most effective strategy for a diabetes care practice to integrate a new continuous glucose monitoring, CGM system into their workflow, considering patient outcomes, clinician training, and technological advancements. Option A. Select a CGM system based on its popularity among a few neighboring practices, without conducting an independent review of its clinical efficacy or patient usability data. Option B. Immediately adopt the latest CGM system released by a leading manufacturer, relying primarily on vendor-provided training and marketing materials to guide implementation. Option C. Introduce CGM technology by providing patients with the device and basic instructions, assuming they will learn to use it effectively through trial and error and online resources. Option D. Implement a phased approach that includes thorough evaluation of CGM system evidence, comprehensive staff and patient training, development of clear data interpretation protocols, and ongoing performance monitoring. Correct answer is D. Implement a phased approach that includes thorough evaluation of CGM system evidence, comprehensive staff and patient training, development of clear data interpretation protocols, and ongoing performance monitoring. Explanation. This scenario presents a common implementation challenge when introducing new diabetes technology, specifically continuous glucose monitoring, CGM, into a clinical practice. The challenge lies in balancing the rapid advancement of CGM technology with the need for standardized, evidence-based, and patient-centered care, all within the existing regulatory and ethical framework for healthcare professionals. Ensuring patient safety, efficacy of treatment, and appropriate reimbursement are paramount. The correct approach prioritizes a systematic, evidence-based, and collaborative implementation strategy. This involves thoroughly evaluating different CGM systems based on clinical evidence, patient needs, and practice workflow. It also emphasizes comprehensive training for both clinicians and patients, establishing clear protocols for data interpretation and device management, and engaging in ongoing quality improvement. This aligns with the ethical obligation to provide competent care, the regulatory requirement to practice within one's scope and to adhere to evidence-based guidelines, and the professional responsibility to ensure patient understanding and adherence. An incorrect approach that focuses solely on adopting the newest technology without rigorous evaluation risks patient harm due to unproven efficacy or usability issues. This could lead to misinterpretation of data, suboptimal glycemic control, and potential adverse events, violating the principle of non-maleficence. Furthermore, it may not align with payer requirements for reimbursement, creating access barriers for patients and ethical dilemmas for the clinician. Another incorrect approach that relies on anecdotal evidence or vendor-specific marketing, without independent clinical validation, fails to uphold the standard of care. This can lead to recommending devices that are not the best fit for the patient population or practice, potentially resulting in patient dissatisfaction and poor outcomes. It also neglects the professional responsibility to critically appraise information and make decisions based on robust evidence. A third incorrect approach that neglects comprehensive patient education and ongoing support undermines patient autonomy and self-management. Patients need to understand how to use the device, interpret the data, and troubleshoot common issues. Without this, the technology's potential benefits cannot be fully realized, and patients may become frustrated or disengaged from their care, leading to suboptimal outcomes and potentially violating the principle of beneficence. The professional decision-making process in such situations should involve a structured approach. 1. Needs assessment. Identify the specific needs of the patient population and the practice. 2. Evidence review. Critically evaluate available CGM technologies based on peer-reviewed clinical studies, guidelines from reputable diabetes organizations, and real-world data. 3. System evaluation. Consider factors beyond clinical efficacy, such as ease of use, data integration capabilities, patient support, and cost-effectiveness. 4. Pilot testing. If feasible, conduct a pilot program to assess the chosen system's performance in the practice setting. 5. Training and protocol development. Develop comprehensive training programs for staff and patients, and establish clear protocols for device management, data interpretation, and follow-up. 6. Ongoing monitoring and quality improvement. Continuously assess the effectiveness of the implemented technology and make adjustments as needed. Question 9. What factors determine the most appropriate insulin delivery system selection for a patient with type 1 diabetes, considering their individual clinical profile and lifestyle, within the framework of U.S. regulatory guidelines for medical devices? Option A. Patient's history of glycemic control, presence of diabetes-related complications, manual dexterity, visual acuity, cognitive function, and lifestyle factors such as work schedule and physical activity. Option B. The clinician's personal preference for a particular insulin delivery system based on their experience with a limited range of devices. Option C. The cost-effectiveness of the insulin delivery system, prioritizing the least expensive option that meets basic insulin delivery needs. Option D. The availability of the latest technological advancements in insulin pump therapy, regardless of patient suitability or cost. Correct answer is A. Patient's history of glycemic control, presence of diabetes-related complications, manual dexterity, visual acuity, cognitive function, and lifestyle factors such as work schedule and physical activity. Explanation. The scenario of selecting an insulin delivery system for a patient with diabetes is professionally challenging because it requires a nuanced understanding of individual patient needs, technological capabilities. In the regulatory landscape governing medical devices, clinicians must balance the potential benefits of advanced systems with the patient's ability to manage them, their lifestyle, and their overall health status. This requires a holistic approach that goes beyond simply identifying a diagnosis. The correct approach represents best professional practice because it prioritizes patient-centered care and adherence to established clinical guidelines and regulatory requirements. By considering the patient's clinical profile, including their diabetes history, glycemic control, dexterity, cognitive function, and lifestyle, clinicians can make an informed decision that maximizes the likelihood of successful therapy and improved health outcomes. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the chosen system is both beneficial and safe for the individual. Furthermore, it adheres to the implicit regulatory expectation that medical devices are prescribed and utilized in a manner consistent with their intended use and the patient's suitability, as overseen by bodies like the FDA in the U.S. An incorrect approach that focuses solely on the most advanced technology available without assessing patient suitability represents a regulatory and ethical failure. This could lead to device misuse, adverse events, and non-adherence, potentially violating the principle of non-maleficence. It also fails to meet the regulatory expectation of appropriate device selection, which could result in suboptimal patient outcomes and potential liability. Another incorrect approach that prioritizes cost-effectiveness above all else, without adequately considering clinical efficacy or patient needs, is also ethically problematic. This could lead to the selection of a less effective or inappropriate system, compromising patient well-being and potentially violating regulatory guidelines that emphasize patient safety and optimal treatment. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical status, including their current diabetes management, glycemic targets, and any complications. This should be followed by an assessment of their technological literacy, manual dexterity, visual acuity, and cognitive ability to manage a specific insulin delivery system. Lifestyle factors, such as work schedule, physical activity, and support systems, are also crucial. Finally, the clinician must be aware of the available insulin delivery systems, their functionalities, limitations, and the relevant regulatory approvals and guidelines for their use. This comprehensive assessment ensures that the chosen system is not only clinically appropriate, but also practically manageable and safe for the individual patient. Question 10. When evaluating traditional blood glucose meters for a patient with type 2 diabetes, which of the following approaches best aligns with the certified diabetes technology clinician's responsibilities under U.S. regulatory frameworks and ethical guidelines for patient care? Option A. Advising the patient to choose a meter solely based on the brand name that is most frequently advertised on television. Option B. Recommending a meter based on a thorough assessment of the patient's dexterity, visual acuity, technological comfort, and financial considerations, alongside an understanding of the meter's accuracy and ease of use. Option C. Suggesting a meter without discussing its potential limitations or the importance of proper technique for obtaining accurate readings. Option D. Selecting the least expensive meter available to ensure affordability for the patient, regardless of its accuracy or user-friendliness. The correct answer is B. Recommending a meter based on a thorough assessment of the patient's dexterity, visual acuity, technological comfort, and financial considerations, alongside an understanding of the meter's accuracy and ease of use. Explanation. The scenario presents a challenge for a certified diabetes technology clinician, CDTC, in the United States, as they must guide a patient on selecting a traditional blood glucose meter, BGM, while adhering to the regulatory landscape governing medical devices and patient care. The CDTC role is to ensure the patient receives accurate and reliable information that supports safe and effective diabetes management, aligning with established clinical guidelines and patient-centered care principles. The challenge lies in balancing the patient's preferences and understanding with the technical specifications and limitations of various BGM devices, all within the framework of U.S. healthcare regulations. The correct approach emphasizes a comprehensive assessment of the patient's individual needs, including their dexterity, visual acuity, technological comfort level, and financial resources, in conjunction with an understanding of the specific performance characteristics of different BGM models. This approach represents best professional practice because it prioritizes patient safety and autonomy by ensuring the chosen device is appropriate for the individual's circumstances and capabilities. It aligns with the ethical obligation to provide evidence-based care and to educate patients effectively, enabling them to participate actively in their diabetes management. Furthermore, it implicitly adheres to FDA regulations concerning medical device selection and use, which require that devices be used in accordance with their intended purpose and labeling, and that healthcare professionals provide appropriate guidance. An incorrect approach that focuses solely on the lowest cost of a BGM without considering accuracy or ease of use would be professionally unacceptable. This failure would violate the ethical principle of beneficence, as it could lead to the selection of a less accurate device, potentially resulting in suboptimal glycemic control and increased health risks for the patient. It could also be seen as a failure to meet the standard of care, as it prioritizes economic factors over patient well-being and effective management. Another incorrect approach that recommends a BGM based solely on brand recognition or marketing claims, without verifying its accuracy or suitability for the patient's specific needs, would also be professionally unacceptable. This approach disregards the importance of objective performance data and patient-specific factors, potentially leading to the selection of a device that is difficult for the patient to use or that provides unreliable readings. This could constitute a violation of professional duty to provide informed guidance and could expose the patient to risks associated with inaccurate glucose monitoring. A third incorrect approach that involves recommending a BGM without discussing its limitations, such as potential interferences or the importance of proper technique, would be ethically and professionally flawed. This omission fails to adequately inform the patient, hindering their ability to use the device correctly and interpret the results accurately. This lack of comprehensive education can lead to misinterpretation of glucose readings, potentially resulting in inappropriate treatment decisions and adverse health outcomes, and represents a failure to uphold the standard of care in patient education. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's clinical profile, functional abilities, and personal preferences. This should be followed by an objective assessment of available BGM technologies, considering factors such as accuracy, ease of use, data management capabilities, and cost. The CDTC must then engage in shared decision-making with the patient, providing clear, unbiased information about the pros and cons of different options, empowering the patient to make an informed choice that best supports their health goals and daily life. This process is guided by principles of patient-centered care, evidence-based practice, and adherence to relevant U.S. healthcare regulations and ethical standards. Question 11. The performance metrics show a significant improvement in time in range for patients using hybrid closed-loop systems, prompting discussions about the next generation of diabetes management tools. Considering the rapid evolution of artificial pancreas technology and the potential for even greater automation and personalized therapy, which of the following represents the most forward-thinking and ethically sound approach for a certified diabetes technology clinician, CDTC, to adopt in preparing for future directions in diabetes technology? Option A. Advocating for a moratorium on the development and adoption of new diabetes technologies until the long-term impacts of current systems are fully understood, to avoid overwhelming patients with rapid changes. Option B. Encouraging patients to explore and experiment with off-label or unapproved technological solutions that show promise in online forums, based on anecdotal evidence of their effectiveness. Option C. Continuing to focus exclusively on optimizing the use of currently approved and widely adopted hybrid closed-loop systems, as these have established performance records and are well understood by both clinicians and patients. Option D. Proactively researching and understanding the regulatory pathways and evidence supporting emerging advanced automated insulin delivery, AID, systems and personalized therapeutic algorithms, while preparing to educate patients on their potential benefits and limitations as they become available and approved. The correct answer is D. Proactively researching and understanding the regulatory pathways and evidence supporting emerging advanced automated insulin delivery, AID, systems and personalized therapeutic algorithms, while preparing to educate patients on their potential benefits and limitations as they become available and approved. Explanation. The performance metrics show a consistent trend of improved glycemic control and reduced hypoglycemia events in patients utilizing advanced automated insulin delivery (AID) systems. This scenario is professionally challenging because it requires clinicians to not only understand the current capabilities of diabetes technology, but also to anticipate and integrate emerging innovations responsibly and ethically, ensuring patient safety and optimal outcomes within the existing regulatory framework. The correct approach represents best professional practice because it prioritizes a patient-centered, evidence-based, and forward-thinking strategy. This involves staying abreast of regulatory approvals for new technologies, understanding their potential benefits and risks, and engaging in shared decision-making with patients. It aligns with the ethical obligation to provide the highest standard of care and to advocate for patients' access to beneficial innovations, while adhering to guidelines that ensure safety and efficacy. An incorrect approach that focuses solely on current, widely adopted technologies without considering emerging advancements fails to leverage the full potential of diabetes technology to improve patient lives. This could be seen as a failure to provide the most effective care available and may not align with the spirit of continuous improvement encouraged by professional bodies. Another incorrect approach that involves recommending unapproved or experimental technologies prematurely, without robust evidence of safety and efficacy or proper regulatory oversight, poses significant risks to patients. This violates the fundamental principle of do no harm and disregards the regulatory processes designed to protect public health. A further incorrect approach that dismisses the potential of new technologies due to a lack of personal familiarity or comfort, without objectively evaluating their evidence base and potential patient benefits, can lead to suboptimal patient care. This demonstrates a potential bias that could hinder patient access to beneficial innovations. A professional decision-making process for similar situations should involve a continuous learning cycle. Clinicians must actively seek out information on emerging diabetes technologies, critically evaluate research and regulatory updates, and understand the implications for patient care. They should engage in open dialogue with patients about available and future options, considering individual needs, preferences, and the current regulatory landscape. Ethical considerations, such as informed consent and equitable access, must be paramount. Question 12. The control framework reveals that a patient with type 1 diabetes is considering transitioning to a new diabetes technology system. The Certified Diabetes Technology Clinician, CDTC, must guide the patient through the selection process. Which of the following approaches best reflects a comprehensive evaluation of the advantages and disadvantages of each system from a stakeholder perspective, ensuring optimal patient care and adherence? Option A. Presenting a detailed comparison of the glucose monitoring accuracy, alert customization, data sharing capabilities, and potential for integration with other health devices for each system, alongside a discussion of the patient's perceived ease of use, learning curve, and potential impact on daily activities. Option B. Recommending the system with the most advanced features and the highest reported accuracy, assuming that superior technology will automatically lead to better outcomes, regardless of patient familiarity or lifestyle. Option C. Prioritizing the system with the lowest out-of-pocket cost for the patient, focusing primarily on financial implications without a thorough assessment of the clinical benefits and potential drawbacks of each option. Option D. Suggesting the system that the clinician has the most personal experience with, based on anecdotal success stories, without a systematic review of the patient's specific needs or the comparative advantages and disadvantages of other available technologies. The correct answer is A. Presenting a detailed comparison of the glucose monitoring accuracy, alert customization, data sharing capabilities, and potential for integration with other health devices for each system, alongside a discussion of the patient's perceived ease of use, learning curve, and potential impact on daily activities. Explanation. This scenario is professionally challenging because it requires the Certified Diabetes Technology Clinician, CDTC, to balance the immediate needs and preferences of a patient with the long-term implications of technology adoption, all within the scope of their professional responsibilities and the evolving landscape of diabetes management. The CDTC must consider not only the technical efficacy of different systems, but also their impact on patient adherence, cost-effectiveness, and the patient's overall quality of life, while adhering to established clinical guidelines and best practices. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered evaluation of each diabetes technology system. This involves a thorough assessment of the advantages and disadvantages of each system from the perspective of the patient, considering factors such as ease of use, data interpretation, potential for hypoglycemia or hyperglycemia alerts, integration with other devices, and the patient's comfort level and technical proficiency. This aligns with the ethical principle of beneficence, ensuring that the chosen technology maximizes benefit for the individual patient. Furthermore, it upholds the principle of autonomy by empowering the patient to make an informed decision based on a clear understanding of the trade-offs involved. Adherence to professional guidelines for diabetes technology assessment and selection, which emphasize individualized care and evidence-based decision-making, is also a key component of this best practice. An incorrect approach that focuses solely on the most advanced or feature-rich system, without adequately considering the patient's ability to utilize it effectively or the potential burden it may impose, fails to uphold the principle of beneficence. This could lead to suboptimal glycemic control, patient frustration, and potential disengagement with the technology, ultimately harming the patient. Another incorrect approach that prioritizes cost savings above all else, without a thorough evaluation of the clinical benefits and risks of each system for the specific patient, could violate the principle of non-maleficence if a less expensive but less effective or riskier system is chosen. This also disregards the patient's right to receive appropriate and effective care. A third incorrect approach that relies on anecdotal evidence or personal preference rather than a systematic evaluation of system advantages and disadvantages, supported by clinical data and patient-specific factors, is professionally unsound and could lead to suboptimal patient outcomes. This demonstrates a failure to adhere to evidence-based practice, a cornerstone of professional responsibility. The professional decision-making process for similar situations should involve a structured approach. First, understanding the patient's clinical profile, lifestyle, and personal goals. Second, systematically reviewing the available diabetes technology systems, identifying their distinct advantages and disadvantages in relation to the patient's needs. Third, engaging in a shared decision-making process with the patient, clearly articulating the pros and cons of each viable option. And finally, selecting the system that best aligns with the patient's overall well-being and treatment objectives, with ongoing monitoring and adjustment as needed. Question 13. Stakeholder feedback indicates a growing interest among patients in utilizing emerging diabetes management apps that claim to offer predictive insights into glucose trends based on lifestyle data, even if these apps are not yet cleared by regulatory bodies for specific medical claims. As a certified diabetes technology clinician, how should you approach this situation when a patient expresses a strong desire to integrate such an app into their daily management routine? Option A. Conduct a thorough assessment of the patient's current diabetes technology and goals, review available clinical evidence and regulatory status of the app, and discuss its potential benefits and limitations with the patient, recommending it only if it aligns with evidence-based practice and patient safety. Option B. Suggest the patient use the app primarily for informational purposes, without relying on its predictive insights for making critical diabetes management decisions, and encourage them to share any data generated with their healthcare team. Option C. Advise the patient to discontinue the use of any unapproved apps and focus solely on their currently prescribed diabetes management devices and therapies. Option D. Immediately recommend the app to the patient, given their expressed interest, to foster patient engagement and explore the potential of new technologies. The correct answer is A. Conduct a thorough assessment of the patient's current diabetes technology and goals, review available clinical evidence and regulatory status of the app, and discuss its potential benefits and limitations with the patient, recommending it only if it aligns with evidence-based practice and patient safety. Explanation. This scenario presents a common implementation challenge in diabetes technology, balancing patient autonomy and access with the need for evidence-based practice and adherence to clinical guidelines. The professional challenge lies in navigating patient preferences, which may be influenced by marketing or anecdotal evidence, against established protocols, and the clinician's responsibility to ensure safe and effective use of technology. Careful judgment is required to avoid both over-reliance on unproven methods and dismissing valid patient concerns. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment that aligns with the principles of evidence-based medicine and ethical clinical decision-making. It involves a thorough review of the patient's current technology, understanding their specific needs and goals, and then recommending solutions that are supported by clinical evidence and regulatory approval for their intended use. This approach ensures that the chosen technology is appropriate for the individual, safe, effective, and integrated into their overall diabetes management plan, thereby upholding the clinician's duty of care and promoting optimal patient outcomes. An incorrect approach that focuses solely on patient preference without clinical validation fails to uphold the clinician's responsibility to provide evidence-based care. This could lead to the use of technology that is not proven to be effective, potentially causing harm or suboptimal management of diabetes. It also risks misrepresenting the capabilities of the technology, which could have ethical implications regarding informed consent. Another incorrect approach that dismisses patient feedback outright, without a thorough assessment, demonstrates a lack of patient-centered care. This can erode trust, lead to patient disengagement, and may result in the patient seeking alternative, potentially less safe, solutions independently. Ethically, it fails to respect the patient's right to participate in their own healthcare decisions. A third incorrect approach that involves recommending technology based on anecdotal success without considering the broader clinical evidence or regulatory guidelines is professionally unsound. While anecdotal evidence can sometimes highlight areas for further investigation, it is not a substitute for rigorous scientific validation and regulatory oversight. This approach risks patient safety and can lead to the adoption of ineffective or even harmful practices. The professional decision-making process for similar situations should involve a systematic approach. 1. Actively listen to and acknowledge all stakeholder feedback, including patient concerns and preferences. 2. Conduct a thorough clinical assessment of the patient's current diabetes management, including their existing technology, lifestyle, and specific goals. 3. Review the available evidence supporting the efficacy and safety of any proposed diabetes technology, considering regulatory approvals and guidelines. 4. Engage in shared decision-making with the patient, discussing the pros and cons of different technological options in a clear and understandable manner. 5. Document the assessment, discussion, and the rationale for the chosen course of action. 6. Provide ongoing support and education to ensure the patient can effectively and safely utilize the chosen technology. Question 14. Governance review demonstrates that a new diabetes management software has been identified as a potential tool to enhance patient engagement and data tracking. However, the software is developed by a third-party vendor with limited information available regarding their specific data security protocols and compliance with patient privacy regulations. As a certified diabetes technology clinician, CDTC, what is the most ethically and professionally responsible course of action regarding the implementation of this software? Option A. Conduct a thorough review of the vendor's data security policies, compliance certifications, and data handling practices, and ensure the software meets all applicable patient privacy regulations before implementation. Option B. Implement the software and inform patients that their data will be managed by a third-party vendor, without explicitly detailing the vendor's security measures or seeking their explicit consent for data sharing beyond general terms of service. Option C. Proceed with implementation after confirming the software is designed for diabetes management, assuming it meets necessary privacy and security standards due to its intended use. Option D. Prioritize the software's cost-effectiveness and user-friendliness, and implement it immediately to provide patients with new technological support, addressing any potential data concerns only if they arise. The correct answer is C. Proceed with implementation after confirming the software is designed for diabetes management, assuming it meets necessary privacy and security standards due to its intended use. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in healthcare technology adoption, specifically concerning patient data privacy, and the clinician's responsibility to ensure the security and integrity of information managed by third-party software. The challenge lies in balancing the potential benefits of new diabetes management software with the inherent risks associated with data sharing and vendor compliance. The clinician must navigate the complex landscape of patient confidentiality, regulatory requirements, and the practicalities of software implementation. Correct approach analysis. The correct approach prioritizes patient safety and data privacy by ensuring the chosen software meets stringent regulatory standards for protected health information, (FI), and has robust security protocols. This aligns with the ethical obligation to act in the patient's best interest and uphold professional standards of care. Specifically, it reflects the principles of beneficence, acting for the patient's good, non-maleficence, avoiding harm, and justice, fairness in access to secure technology. The clinician's due diligence in verifying vendor compliance with relevant data protection laws, e.g., HIPAA in the U.S., or equivalent regulations in other specified jurisdictions, is paramount. This proactive stance minimizes the risk of data breaches, unauthorized access, and potential harm to patients, thereby upholding professional integrity and trust. Incorrect approach is analysis. One incorrect approach involves prioritizing cost savings and perceived ease of use over data security. This fails to acknowledge the significant regulatory and ethical implications of handling sensitive patient data. Such an approach could lead to violations of data privacy laws, resulting in substantial fines, reputational damage, and most importantly, harm to patients through potential data breaches or misuse of their health information. It demonstrates a lack of due diligence and a disregard for the clinician's fiduciary duty to protect patient confidentiality. Another incorrect approach is to assume that any software marketed for diabetes management is inherently compliant and secure without independent verification. This passive stance abdicates the clinician's responsibility to ensure the tools used in patient care meet established standards. Relying solely on vendor claims without independent assessment is a significant ethical and regulatory failing, as it could expose patient data to vulnerabilities that the vendor may not have adequately addressed or disclosed. A third incorrect approach is to implement the software without a clear understanding of its data handling practices, including how data is stored, transmitted, and who has access to it. This lack of transparency and understanding creates a significant risk of non-compliance with data protection regulations and a failure to adequately inform patients about how their data is being managed. It prioritizes expediency over responsible implementation and patient empowerment. Professional reasoning. Professionals should adopt a systematic approach to technology adoption. This involves 1. Identifying patient needs and potential technological solutions. 2. Conducting thorough due diligence on potential software vendors, focusing on their security measures, data privacy policies, and compliance with relevant regulations. 3. Seeking expert advice if necessary, particularly regarding legal and technical aspects of data security. 4. Developing clear protocols for software use, data management, and incident response. 5. Regularly reviewing and updating these protocols as technology and regulations evolve. This structured process ensures that patient well-being and data security remain at the forefront of all technology-related decisions. Question 15. The evaluation methodology shows that a patient with type 1 diabetes is using a continuous glucose monitor, CGM, from one manufacturer and an insulin pump from another, and has also been prescribed a smart insulin pen for prandial insulin delivery. The patient expresses a desire to have all this data consolidated to better understand their glycemic patterns and insulin dosing effectiveness. As a certified diabetes technology clinician, CDTC, what is the most ethically and professionally sound approach to data integration in this scenario? Option A. Proceed with integrating data from the CGM and insulin pump, as these are typically considered core diabetes management devices, and inform the patient of this action. Option B. Prioritize integrating data from the CGM and smart insulin pen, as these provide direct glucose and bolus information, and defer integration of the insulin pump data due to potential compatibility issues. Option C. Integrate all available data from the CGM, insulin pump, and smart insulin pen without further discussion, assuming the patient's consent by virtue of their expressed desire for consolidated data. Option D. Obtain explicit, informed consent from the patient to integrate data from all three devices, clearly explaining the purpose, benefits, and limitations of data consolidation for their diabetes management. The correct answer is D. Obtain explicit, informed consent from the patient to integrate data from all three devices, clearly explaining the purpose, benefits, and limitations of data consolidation for their diabetes management. Explanation. This scenario presents a common ethical and professional challenge for certified diabetes technology clinicians, CDTC, when integrating data from multiple diabetes technology devices for a patient. The core difficulty lies in balancing the patient's autonomy and privacy with the clinician's responsibility to provide the most accurate and comprehensive care. Patients may have varying levels of comfort with data sharing, and the clinician must navigate these preferences while ensuring that the integrated data is used effectively for therapeutic decision-making. The CDTC must also consider the potential for data discrepancies or misinterpretations when combining information from different sources, which could impact patient safety and treatment efficacy. The correct approach represents best professional practice because it prioritizes informed consent and patient autonomy, aligning with fundamental ethical principles and regulatory frameworks governing patient data. By obtaining explicit consent for data integration and clearly explaining the purpose and scope of data use, the CDTC upholds the patient's right to control their personal health information. This approach also ensures that the patient is an active participant in their care, fostering trust and adherence to treatment plans. Furthermore, it demonstrates a commitment to data security and privacy by only integrating data with the patient's explicit permission and for clearly defined clinical purposes. An incorrect approach that involves unilaterally integrating data from all available devices without explicit patient consent represents a significant regulatory and ethical failure. This violates patient privacy rights and data protection regulations, which mandate that personal health information cannot be accessed or shared without authorization. Such an action erodes patient trust and could lead to legal repercussions. Another incorrect approach, that of only integrating data from devices the clinician personally prefers or finds easiest to access, is professionally unacceptable as it prioritizes clinician convenience over optimal patient care and ignores the potential benefits of a comprehensive data picture. This can lead to suboptimal treatment decisions and potentially harm the patient. Finally, an approach that involves integrating data but failing to adequately explain its implications or potential limitations to the patient is also ethically flawed. This can lead to misinterpretation of data by the patient, anxiety, or a lack of understanding regarding their diabetes management, undermining the therapeutic alliance. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient's understanding of their diabetes technology and their comfort level with data sharing. 2. Clearly explain the benefits of integrating data from multiple devices for their diabetes management, including improved insights and personalized treatment adjustments. 3. Obtain explicit, informed consent from the patient for the integration of specific data sources, detailing what data will be integrated, how it will be used, and who will have access to it. 4. Discuss any potential limitations or challenges in data integration and interpretation. 5. Respect the patient's decision regarding data sharing and offer alternative approaches if they are not comfortable with full integration. 6. Ensure all data handling practices comply with relevant privacy and security regulations. Question 16. Benchmark analysis indicates that a new AI-powered predictive algorithm for glycemic excursions is being considered for integration into a diabetes management program. As a certified diabetes technology clinician, CDTC, what is the most critical regulatory compliance consideration before recommending its adoption? Option A. Assumption that the AI algorithm is compliant with all applicable regulations due to its advanced technological capabilities. Option B. Verification that the AI algorithm has obtained appropriate regulatory clearance or approval for its intended use as a medical device, and that its data handling practices comply with relevant privacy laws. Option C. Assessment of the AI algorithm's potential to reduce clinician workload and improve patient engagement, irrespective of regulatory status. Option D. Confirmation that the AI algorithm is developed by a well-known technology company with a strong reputation for innovation. The correct answer is B. Verification that the AI algorithm has obtained appropriate regulatory clearance or approval for its intended use as a medical device, and that its data handling practices comply with relevant privacy laws. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified diabetes technology clinician, CDTC, by requiring them to evaluate the regulatory compliance of an artificial intelligence, AI, tool used in diabetes management. The challenge lies in understanding the evolving regulatory landscape for AI in healthcare, specifically within the context of medical devices and data privacy, while ensuring patient safety and efficacy. CDTC must navigate the intersection of clinical best practices, technological innovation, and stringent regulatory requirements. The rapid advancement of AI necessitates continuous learning and a proactive approach to compliance. Correct approach analysis. The correct approach involves a thorough review of the AI tool against established regulatory frameworks governing medical devices and data privacy. This includes verifying that the AI tool has received appropriate clearance or approval from relevant regulatory bodies, e.g., FDA in the U.S., for its intended use in diabetes care. It also necessitates an assessment of the tool's data handling practices to ensure compliance with privacy regulations, e.g., HIPAA in the U.S., including data security, consent, and de-identification protocols. This approach represents best professional practice because it prioritizes patient safety, data integrity, and legal compliance, aligning with the CDTC ethical and professional obligations. Adherence to these regulations ensures that the AI tool is safe, effective, and used in a manner that protects patient privacy. Incorrect approach is analysis. An approach that solely focuses on the AI tool's perceived clinical utility without verifying regulatory approval is professionally unacceptable. This failure constitutes a significant regulatory and ethical lapse, as it bypasses essential safety and efficacy evaluations mandated by regulatory bodies. Risks deploying unproven or unsafe technology, potentially harming patients. Another incorrect approach is to assume that any AI tool developed by a reputable technology company is automatically compliant with healthcare regulations. This assumption is dangerous, as it overlooks the specific requirements for medical devices and data handling in the healthcare sector, which differ from general technology standards. This leads to regulatory noncompliance and potential data breaches. Furthermore, an approach that prioritizes the speed of AI implementation over a comprehensive regulatory review is also professionally unsound. While efficiency is desirable, it cannot come at the expense of patient safety and regulatory adherence. This disregard for due diligence can result in the use of non-compliant tools, leading to legal repercussions and erosion of patient trust. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with identifying the specific regulatory jurisdiction applicable to the AI tool and its use. This involves understanding the classification of the AI tool as a medical device, if applicable, and the relevant data privacy laws. The next step is to actively seek and verify regulatory documentation, such as FDA clearance or approval letters, and to conduct a thorough review of the vendor's compliance documentation regarding data security and privacy. Clinicians should engage with their institution's compliance and legal departments when in doubt. Finally, ongoing monitoring of regulatory updates and AI tool performance is crucial to maintain compliance and ensure continued patient safety. Question 17. The performance metrics show that a significant portion of patients are accessing the diabetes management app daily, but a review of patient-reported outcomes indicates a plateau in glycemic control for this group. Which approach best aligns with best practices for patient engagement and education through technology within the regulatory framework? Option A. Recommend that patients discontinue using the app and revert to traditional paper-based methods for diabetes tracking and education, as the technology appears to be ineffective. Option B. Increase the frequency and volume of educational content delivered through the app, assuming that more information will eventually lead to improved understanding and adherence. Option C. Conduct personalized interviews with a representative sample of these patients to understand their experience with the app. Identify specific barriers to effective self-management despite app usage, and tailor follow-up educational content and support based on their feedback. Option D. Focus on troubleshooting technical issues with the app, as the high usage suggests the platform itself is the primary driver of the plateau. The correct answer is C. Conduct personalized interviews with a representative sample of these patients to understand their experience with the app. Identify specific barriers to effective self-management despite app usage, and tailor follow-up educational content and support based on their feedback. Explanation. This scenario presents a common challenge in diabetes technology, ensuring that the educational tools provided to patients are not only accessible, but also effectively utilized to improve self-management. The professional challenge lies in interpreting performance data beyond simple usage statistics to understand the true impact on patient engagement and health outcomes, while adhering to the regulatory framework governing patient education and data privacy. Careful judgment is required to move from raw data to actionable insights that support patient empowerment. The correct approach represents best professional practice by focusing on qualitative feedback and personalized interventions. This aligns with the ethical imperative to provide patient-centered care and the regulatory expectation that technology be used to enhance, not hinder, patient understanding and autonomy. By seeking direct patient input and tailoring education based on individual needs and technology comfort levels, clinicians uphold the principles of informed consent and effective communication, ensuring that technology serves as a bridge to better diabetes management. This approach respects patient dignity and promotes shared decision-making, which are cornerstones of ethical healthcare delivery. An incorrect approach that relies solely on quantitative usage data fails to acknowledge the nuances of patient engagement. Simply observing that a patient accesses an app does not guarantee comprehension or behavioral change. This can lead to a false sense of success and potentially overlook patients who are struggling despite using the technology, creating an ethical gap in care provision. Furthermore, without understanding the context of use, it may violate the spirit of regulations that mandate effective patient education, as the education provided may not be truly understood or applied. Another incorrect approach that focuses on pushing more content without assessing comprehension or addressing barriers is also professionally unacceptable. This can overwhelm patients, leading to disengagement and frustration, and may inadvertently violate regulations requiring clear, understandable patient education. It prioritizes the delivery of information over the patient's ability to process and utilize it, undermining the goal of improved self-management and potentially leading to adverse health outcomes. This approach can also raise privacy concerns if patient data is used to push content without explicit consent or a clear benefit to the patient. A third incorrect approach that assumes all patients will benefit equally from the same technological interventions ignores individual differences in learning styles, technological literacy, and personal circumstances. This can lead to disparities in care and may not meet the regulatory requirements for providing accessible and effective education to all patient populations. It fails to recognize the ethical obligation to provide equitable care and can result in patients being left behind, unable to leverage the technology for their benefit. The professional reasoning process for similar situations should involve a continuous cycle of assessment, intervention, and evaluation. Clinicians should begin by understanding the patient's individual needs, technological comfort, and learning preferences. They should then select and implement technology-based educational tools that are appropriate for that individual. Crucially, they must then actively seek feedback on the effectiveness of these tools, not just in terms of usage, but in terms of patient understanding and confidence in self-management. This feedback should inform ongoing adjustments to the educational approach, ensuring that technology is a supportive tool rather than a barrier. Adherence to privacy regulations regarding patient data and informed consent for the use of technology in education is paramount throughout this process. Question 18. The control framework reveals that a patient with type 2 diabetes, recently prescribed an insulin pump, expresses anxiety about managing the device alongside their existing oral medications. Which of the following implementation strategies best aligns with best professional practice for ensuring safe and effective use of this new insulin delivery system? Option A. Conduct a comprehensive, hands-on training session with the patient, demonstrating all aspects of the insulin pump's operation, including infusion set changes and bolus calculations, while actively soliciting and addressing their concerns and questions. Option B. Provide the patient with the insulin pump manufacturer's user manual and schedule a follow-up appointment in 3 months to review their progress. Option C. Focus solely on the technical specifications of the insulin pump during the initial consultation, leaving detailed operational training to a future appointment. Option D. Prescribe the insulin pump and assume the patient will learn its operation through trial and error, given their prior experience with insulin pens. The correct answer is B. Provide the patient with the insulin pump manufacturer's user manual and schedule a follow-up appointment in 3 months to review their progress. Explanation. Scenario analysis. This scenario presents a common implementation challenge in diabetes technology, ensuring patient understanding and appropriate use of different insulin delivery systems. The challenge lies in the clinician's responsibility to assess not just the technical aspects of the devices, but also the patient's capacity to manage them safely and effectively, considering their individual needs, cognitive abilities, and lifestyle. This requires a nuanced approach that goes beyond simply explaining how a device works. The clinician must anticipate potential barriers to adherence and safety, which are critical for preventing adverse events and optimizing glycemic control. Correct approach analysis. The correct approach emphasizes a comprehensive, patient-centered assessment and education process. It involves evaluating the patient's readiness for a specific insulin delivery system, considering their understanding of diabetes management, their dexterity, visual acuity, and cognitive function. This approach aligns with the ethical imperative to provide competent care and to ensure patient safety. Regulatory frameworks for medical devices, including those for insulin delivery systems, mandate that healthcare professionals provide adequate training and ensure patients can use the devices as intended. This includes verifying understanding and addressing any concerns or limitations the patient may have. This approach prioritizes patient autonomy and safety by empowering them with the knowledge and skills necessary for effective self-management, thereby minimizing risks associated with improper use. Incorrect approaches analysis. One incorrect approach involves solely relying on the manufacturer's provided instructions without a personalized assessment of the patient's comprehension and ability to follow them. This fails to meet the professional obligation to ensure patient understanding and safe use, potentially leading to medication errors or suboptimal glycemic control. It bypasses the clinician's critical role in tailoring education to the individual's learning style and needs, which is a cornerstone of patient-centered care and a likely requirement under professional practice guidelines. Another incorrect approach is to assume that because a patient has used one type of insulin delivery system, they will automatically be proficient with a different one. Each system, whether an insulin pen, a syringe, or an insulin pump, has unique operational characteristics and potential failure modes. Failing to provide specific, hands-on training and verification for each new system constitutes a lapse in due diligence and can compromise patient safety. This overlooks the importance of specific device training mandated by regulatory bodies overseeing medical devices and patient safety. A third incorrect approach is to proceed with device prescription without actively soliciting and addressing patient concerns or questions. This can lead to a patient feeling overwhelmed or hesitant to use the device, resulting in poor adherence and potentially dangerous management of their diabetes. Ethical practice demands open communication and a supportive environment where patients feel comfortable expressing their difficulties, which is essential for successful technology adoption and ongoing management. Professional reasoning. Professionals should adopt a systematic approach that begins with a thorough patient assessment. This assessment should cover not only clinical factors, but also psychosocial and cognitive aspects relevant to technology use. Following this, education should be individualized, interactive, and include opportunities for return demonstration and competency verification. Ongoing support and follow-up are crucial to address emerging challenges and reinforce learning. This decision-making process is guided by the principles of patient safety, efficacy of treatment, and adherence to regulatory and ethical standards governing the use of medical technologies. Question 19. Quality control measures reveal that a clinician's patient education materials on the historical evolution of diabetes management technologies are not consistently reflecting the most impactful advancements in improving patient safety and glycemic control. Which of the following historical technological developments, when considered in the context of their impact on patient outcomes and regulatory acceptance, best exemplifies a significant and sustained improvement in diabetes management? Option A. The initial development of blood glucose meters that allowed for self-monitoring of blood glucose, a crucial step, but one that predates the advanced data interpretation and predictive capabilities of later technologies. Option B. The widespread adoption of early insulin syringes and vials, which, while revolutionary for their time, were primarily focused on delivering insulin without advanced monitoring or alert capabilities. Option C, the introduction of continuous glucose monitoring, CGM systems that provide real-time glucose readings, trend data, and alerts for hypo and hyperglycemia, leading to improved glycemic control and reduced adverse events. Option D, the development of the first mechanical insulin pumps, which offered a more consistent insulin delivery than injections, but lacked the sophisticated algorithms and safety features of modern devices. The correct answer is C, the introduction of continuous glucose monitoring, CGM, systems that provide real-time glucose readings, trend data, and alerts for hypo and hyperglycemia, leading to improved glycemic control and reduced adverse events. Explanation: this scenario presents a professional challenge because it requires a clinician to critically evaluate the historical context of diabetes management technologies and apply that understanding to current patient care decisions, specifically within the regulatory framework of the Certified Diabetes Technology Clinician (CDTC) exam. The challenge lies in discerning which historical advancements have demonstrably improved patient outcomes and safety, aligning with the CDTC mandate to promote evidence-based, safe, and effective use of diabetes technology. Careful judgment is required to avoid anachronistic or unsupported technological recommendations. The correct approach represents best professional practice because it prioritizes the evolution of technologies that have demonstrably improved glycemic control, reduced hypoglycemia, and enhanced quality of life, as supported by clinical evidence and regulatory acceptance over time. This aligns with the CDTC focus on evidence-based practice and patient-centered care, ensuring that technology adoption is driven by proven benefits and adherence to evolving standards of care and safety guidelines. The historical perspective allows for a nuanced understanding of why certain technologies have become standard of care and others have been superseded, reflecting a commitment to continuous improvement in diabetes management. An incorrect approach that focuses solely on the novelty of a technology without considering its historical impact on patient outcomes or its current regulatory standing fails to meet the CDTC standards. This could lead to recommending technologies that are not well validated, potentially posing risks to patients or failing to provide the expected benefits. Another incorrect approach might be to dismiss all older technologies without acknowledging their foundational role or the specific patient populations for whom they might still be appropriate or were once the best available option. This demonstrates a lack of comprehensive understanding of the technological landscape and its development. Furthermore, an approach that ignores the regulatory evolution of these technologies, focusing only on the technical aspects, would be a significant ethical and professional failure, as patient safety and efficacy are paramount and are often dictated by regulatory oversight and approval processes. Professionals should approach such situations by first understanding the historical trajectory of diabetes technology, identifying key milestones and their impact on patient care. This involves reviewing evidence from the time of introduction of these technologies and comparing it to current best practices and available evidence. The decision-making process should then involve assessing the current clinical utility, safety profile, and regulatory approval status of any technology being considered, ensuring it aligns with current guidelines and patient-specific needs. This iterative process of historical understanding, evidence review, and current assessment is crucial for making informed and responsible clinical decisions in the field of diabetes technology. Question 20. Compliance review shows a patient using a continuous glucose monitor, CGM, expresses confusion about how the device translates their body's glucose levels into the numbers displayed on their receiver. The clinician needs to address this by explaining the underlying mechanism of action. Which of the following approaches best aligns with best practices for patient education and regulatory expectations for diabetes technology use? Option A. Reassure the patient that the device is functioning correctly and that understanding the intricate details of its operation is not necessary for effective diabetes management. Option B. Advise the patient to refer to the device's user manual for a comprehensive understanding of its technical specifications and operational principles. Option C. Provide a detailed explanation of the electrochemical reaction occurring at the sensor, the signal transduction pathways, and the specific algorithms used for data processing, using technical terminology. Option D. Explain in simple terms how the sensor measures glucose in the fluid between cells, how the device interprets this measurement, and how this information helps in making treatment decisions, checking for understanding throughout the explanation. The correct answer is C. Provide a detailed explanation of the electrochemical reaction occurring at the sensor, the signal transduction pathways, and the specific algorithms used for data processing, using technical terminology. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinician to evaluate patient understanding of complex physiological processes related to diabetes technology. Ensuring accurate comprehension is crucial for safe and effective self-management, adherence to treatment plans, and optimal use of technology. Misunderstanding mechanisms of action can lead to incorrect interpretations of device data, inappropriate adjustments to therapy, and potentially adverse health outcomes. The clinician must navigate the nuances of patient education, tailoring explanations to individual learning styles and existing knowledge, while adhering to professional standards of care and regulatory expectations for patient education. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the patient's stated confusion by providing a clear, concise, and accurate explanation of the continuous glucose monitors, CGM, mechanism of action. This involves explaining how the sensor measures interstitial glucose, how the algorithm translates this data into glucose readings, and how these readings inform therapeutic decisions. This aligns with regulatory frameworks that emphasize patient education and empowerment in managing chronic conditions, ensuring patients can actively participate in their care and utilize technology effectively. Ethically, it upholds the principle of beneficence by actively working to improve patient understanding and safety. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's question as unimportant because the device is functioning correctly. This is a regulatory and ethical failure because it neglects the fundamental principle of patient education and autonomy. Regulatory guidelines for diabetes technology often mandate that patients understand how their devices work to ensure safe and effective use. Ethically, it violates the principle of non-maleficence by potentially allowing the patient to continue using the technology with a critical knowledge gap that could lead to harm. Another incorrect approach is to provide a highly technical and jargon-filled explanation that mirrors the device's manual. This is professionally unacceptable because it fails to meet the patient's need for understandable information. While technically accurate, it does not facilitate comprehension and can exacerbate confusion, leading to poor adherence and potential misuse. This approach disregards the clinician's responsibility to translate complex information into a patient-friendly format, a key component of effective diabetes education and a regulatory expectation for patient engagement. A third incorrect approach is to simply tell the patient that the device is accurate and they don't need to understand the how. This is a significant ethical and regulatory lapse. It undermines patient autonomy and the right to informed decision-making. Regulatory bodies expect healthcare professionals to equip patients with the knowledge necessary to manage their health conditions, especially when using advanced technology. Failing to explain the mechanism of action prevents the patient from truly understanding the data they are receiving and how it relates to their body's response to treatment, hindering their ability to make informed choices. Professional reasoning. When faced with a patient questioning the mechanism of action of their diabetes technology, a professional should first acknowledge and validate the patient's curiosity. The next step is to assess the patient's current level of understanding and tailor the explanation accordingly. This involves using clear, simple language, analogies if appropriate, and focusing on the core concepts that are essential for safe and effective use of the device. The goal is to empower the patient with knowledge, fostering confidence and improving self-management. Professionals should always prioritize patient comprehension over simply delivering technical details, ensuring that education is a collaborative and patient-centered process, in line with regulatory mandates for effective patient care.